I'm a health psychology researcher, which means I focus on psychosocial aspects of coping with arthritis and how it impacts the person living with the disease as well as family members. And I also focus a lot of my research on Aboriginal peoples in Canada in terms of how the disease impacts their lives. In terms of my background, I have a PhD in educational studies, a master's in family studies, and a bachelor's in psychology, which packaged together gives me the health psychology research expertise. My colleagues at the Arthritis Research Centre of Canada represent a wealth of expertise, including rheumatology, arthritis specialists, health economists, physical therapists, occupational therapists, educators, biostatisticians, and a variety of other disciplines, and importantly, consumers or people living with arthritis who contribute their expertise to the research projects. The focus of the Arthritis Research Centre is on preventing arthritis, treating arthritis, and the self-management of the more than 100 types of arthritis. My interest first began when I realized the severe disability and occurrence of arthritis in First Nations and Métis and Inuit communities in Canada, which make up Aboriginal peoples in Canada. We know from national surveys that the communities are just devastated by arthritis. Approximately 27% have some type of arthritis, compared to non-Aboriginals, which have arthritis about 16%, or 1 in 6. On top of that, we know that they get the disease more severely and often younger than non-Aboriginals. In 2006, I had an opportunity to present at a conference on BC coastal communities and their health conditions. And now retired Senator Patricia Carney invited me to speak about arthritis and its impact in Aboriginal communities. At that conference, I was fortunate to meet a health director at a First Nations band on Vancouver Island, and subsequently began a relationship with the Caucasian District Council, which serves 7 on-reserve communities on Vancouver Island and their health center. From that, my work led to a recognition that that community had already identified, like the national surveys, that arthritis was devastating. In fact, the #1 chronic disease in all of Aboriginal peoples in Canada. And at that time, it coincided with the Canadian Arthritis Network, who was establishing a National Aboriginal Arthritis Research Initiative, or NARI, to really promote or foster partnerships between researchers and Aboriginal communities to better define the burden of arthritis in Canada, and ultimately to provide evidence to document the seriousness of the condition and the need for more resources to work on treatments and cure. So we partnered with the Caucasian District Council and their health centers, the executive of the band council, Mr. James Wilson, the health director, now Phyllis Jorgensen, and others, to identify the burden of the disease in the community, that is, how prevalent are the different types of arthritis, and to evaluate the types of care in the community. We were fortunate to be funded by the Canadian Arthritis Network, which allowed us to do a 2-year study to document those issues. Sure. The project I'm involved with is part of a larger study that's ultimately looking at hip osteoarthritis and a cause and a way potentially to treat it. Specifically, we're looking at the possibility if a combination of participation in certain types of physical activities combined with subtle deformities in the hip can lead to osteoarthritis of the hip. We received funding from the federal government of Canada through the Canadian Institutes of Health Research, one of 4 studies, to receive $2.5 million over 5 years for our project. Our research is led by Dr. John Esdale, who's the PI, Principal Investigator, and the Scientific Director of the Arthritis Research Centre of Canada. For our work, we're going to look specifically at 3 groups of people in Canada. Chinese in Canada, where we believe they have a very low incidence or frequency of hip osteoarthritis. Aboriginal people in Canada, where we believe there's a high incidence of hip osteoarthritis, and Caucasians, where we believe they're somewhere in the middle. And by focusing on those groups, we'll be able to answer some of those questions. Well, as I mentioned earlier, at the Arthritis Research Centre, we have a consumer advisory board, in which people with arthritis work with researchers to help identify study questions, to sort of vet research questions, help interpret information, as well as help develop strategies to share the information or disseminate the information. For this study, we're working with a group of people from the Consumer Advisory Board at the Arthritis Research Center, and they've already been involved in helping develop and refine our research questions for the study. They've helped provide input in our strategies on how we're going to do this study, but then importantly, what are you going to do with the information at the end of it, so it doesn't just sit on a shelf. So they'll be working closely with us to develop strategies to ensure the information reaches various stakeholder groups, so other patient groups, advocacy groups, public forums, that sort of thing. And we'll also be working with consumers in Vancouver Island in the Aboriginal communities to ensure their perspectives are reflected on the project. For example, they will help review questionnaire items to ensure the wording is appropriate, to ensure that it's culturally relevant. They will provide input on how we conduct the interviews in the various communities, and they will help us interpret the information and ensure that it gets out through health newsletters that are delivered to every home, through public forums, and through related events. Well, ultimately, the results will be used to reduce the burden of arthritis in the Aboriginal communities. As I mentioned earlier, the Aboriginal people in Canada are being devastated by arthritis. It's not always well known what in First Nations, Métis and Inuit communities, or in the general public, but as I said earlier, it is the #1 chronic disease. In this research, the results will ultimately, we believe, be able to be used to prevent osteoarthritis of the hip. If indeed we do find out that certain physical activities combined with some minor deformities of the hip lead to cartilage damage in the hip and thus causing osteoarthritis of the hip, we can do something about that. For example, if we find that a physical examination of the hip produces the same information that x-rays do, then only physical examinations may need to be conducted to identify people who likely will develop osteoarthritis of the hip. This will ultimately save money in terms of healthcare cost and will lead to the training of health professionals to conduct such examinations. For people in the community, what the results might show is that we can indeed prevent osteoarthritis of the hip. We can modify people's physical activities so they don't develop the cartilage damage in their knees, which then causes osteoarthritis. This would be a huge movement forward, both for people in the Aboriginal community and non-Aboriginals, to minimize the prevalence of osteoarthritis of the hip and ultimately improve their quality of life. Working in partnership with the First Nations communities has been some of the most rewarding work I've ever done thus far in my research career. As you mentioned, and as I mentioned earlier, arthritis is so prevalent in the communities and so devastating, both at the individual level and the community level, that to be able to be in a position to work with a group of people to do something that matters, to make a difference, is in itself hugely rewarding. For me, I've been blown away, for the lack of a better word, by the level of involvement of the community. In our previous research, we did a door-to-door survey to identify how prevalent arthritis was and evaluate access to care. 75%, 3/4 of all adults in the communities we surveyed participated. That alone is amazing, leaves you speechless and breathless. But also what I found is there's lots of interest and people are motivated to really be involved in a true community-based research, a true partnership, which I don't think you always find. And in my experience, I found this and it's been extremely rewarding. And what I've also found is that, although not perhaps always discussed, there's a tremendous level of resiliency in the communities and a lot of knowledge that's just been built up over generations in their culture that I've been privy to through this partnership, and for that I'm grateful and thankful.